Welcome to the FOCIS Podcast, brought to you by the FOCIS Communications Committee.
Well, hello, Dr. Rathmell. Thank you so much for being here with me today. To start off this interview, what research have you conducted that you're most proud of, or any papers that you've worked on recently?
Yeah, so we've been interested in metabolism and how cell metabolism affects what lymphocytes and immune cells do for now about 20 years. Probably the thing I'm most proud of is the fact that people are now thinking about metabolism. Some of these pathways and some of the biochemistry behind it has been a little esoteric, but it's now hit the mainstream, and it becomes even more important because now people are thinking about processes like diet. How does what you eat affect your immune system? How do different cells within the same tissue interact with each other to exchange nutrients, and how do they mix and match? So the field has come from almost nothing to touching everyone, and you see it just throughout the meeting here at FOCIS, but you see it across immunology and science. There's a few specific papers that stand out. We had a paper about, I want to say 12 years ago in the Journal of Immunology, where we showed that as lymphocytes change and as they go through this process of getting activated and functioning, they're all a little bit different metabolically. And that's really important because it shows that as they change, you could potentially target them individually. So this has also led to a kind of a birth of whole field to try to understand, can we modulate the immune system by changing metabolism? And this feeds into the dietary aspects, but also there's drug targets. And so that has spawned a lot of research, and I'm pretty proud of that.
Well, that sounds very interesting. What would you say is next for you in your future career?
Well, I'm right now in the middle of a transition. I've been at Vanderbilt University Medical Center for the past 10 years, directing the Vanderbilt Center for Immunobiology. That's been fantastic. I really loved it. I have an opportunity to move to the University of Chicago, so I'm going to be moving on as a department chair there. And I'm looking forward to moving on this career transition from running my own lab and running a small center where we're trying to support trainees and junior faculty, to now running a department where it's going to be much more of a defined effort to build a community around, in this case, it's cancer biology, but it's tumor microenvironment, a lot of tumor immunology. Then I'm excited about the transition.
Congratulations on the new role, and hopefully it's a new transition for you.
Yeah.
So then, if your colleague asked you why you should join FOCIS, what would you tell them?
Yeah, FOCIS is a unique organization. It covers a huge span of immunology, really all of immunology. And by bringing in all the different societies, the Federation of Societies, but bringing all the different societies, you really have all the expertise across anything you could think about in immunology. But it's all in one sort of small group. So the meeting itself is nice sized. It's a great meeting to go to. Very diverse, but not overwhelming in scale. The focus of FOCIS, when you come to the meeting, is really on interactions that are translational. How can you take the basic science and make it more relevant for patients, more relevant for the communities? This is what a lot of the foundations and a lot of the societies, they might have a specific disease that they're interested in, but it all kind of comes together here. So for trainees, they're very interested in translational science and how they can make a difference. This is a really good setting for that. There's a lot of biotechnology here, a lot of industry here. It's definitely has a basic science sort of component to it, but it tries to take the next step to the patients. So I think that it's a really nice organization and unique because of the breadth and this translational aspect.
Right. Well, thank you so much for being here with me today. Appreciate all that you had to say.
All right, thank you.
And now we will hear from Dr. Monica Guzman, the Committee for Inclusion and Representation Chair.
Well, hello, Dr. Guzman. Thank you so much for being here today. To start out the podcast, what research have you conducted that you're most proud of, or any papers you'd like to talk about?
So I'm going to tell you the story that we are the most proud of, which is a set of molecules that we discovered. It's a network of proteins that we call the epichaperone. And this network of proteins were thought or discovered to be a vulnerability of cancer. This was published in 2016, which was a while ago. And when we published this, we made a biomarker that would allow us to identify those patients that would be most likely to respond to a therapy that will inhibit this epichaperone. And fast forward time, we had the opportunity to treat a patient that had acute myeloid leukemia, and she didn't have any other choice of therapy. So we performed our test, and she happened to have a leukemia that was epichaperone positive. So using a compassionate trial in collaboration with a clinician named Dr. Gail Roberts at Weill Cornell Medicine, she conducted this you will call it's a compassionate trial. And this compassionate trial was very successful on this patient. She actually went into complete remission and lasted in remission for more than 4 years. But what's very unique about this is we also learned that the reason that we believe she was responding for so long is that she had T cells that belong from a transplant that she had previously. And these T cells had this activity against leukemia. And that opened a new field of research for us, which now we're investigating the role of this epichaperone in T cells and see how we can start a new clinical trial for patients with acute myeloid leukemia in the context of bone marrow transplantation.
Well, that is really interesting. Thank you so much for sharing that with us. And then moving on, what would you say is next for you in your career?
What is next for me is, in addition to do the research we do, is really we want to put efforts on bringing more younger generations into science. I think having pipeline programs, so to speak, bringing high school students, undergrads to the field of science, to the field of immunology is very important. I think once you discover what is to be doing research and the magic of knowing something that you didn't know can change someone's life. And if you bring people into this field, I think many more discoveries can be made. So that's next for me in the career.
Yeah, well, that sounds like a great plan, and hopefully you guys can continue to recruit younger students. Thank you so much for taking the time to interview with me today.
Thank you.